We begin with the CDC's new mask guidelines for areas of high or substantial COVID transmission. What does that mean? Here in the Bay Area, at least 4 counties are seeing high positivity rates. And we have team coverage on the mask recommendations. KPIX5's Kenny Choi is live in the East Bay with why some doctors are saying transmission data might not be the best to determine health guidelines. What do you mean, Kenny?
Ken, that's right. So Contra Costa County has one of the highest case rates in the Bay Area right now, according to the latest data by the CDC. Some leading health experts say that the CDC should be using a different metric in determining mask mandates and recommendations.
Oh gosh, here we go.
Bay Area counties, including Contra Costa, have already recommended people wear masks.
Ready to conquer the world.
In public indoor spaces, vaccinated or not, as cases rise again. The latest CDC reversal creating angst, anger, and debate.
It's a touchy subject for a lot of people. You know, it's their right. Absolutely, it's their right. But it's also my right. Why should I have to wear masks inside and outside if I've got the vaccine and you don't want to? Then you wear the mask.
They say people like me who have not been vaccinated are causing these different variants, and so therefore there's an increase. So I definitely understand why.
The Centers for Disease Control and Prevention's new recommendation to mask indoors, vaccinated or not, in areas of substantial or high levels of transmission is based on case and positivity rates. But UCSF's Dr. Monica Gandhi and other leading experts believe a different metric should be used as the main determining factor.
Restrictions, once we get vaccinations, should actually be linked to hospitalization rates and not case rates.
Dr. Ori Savili of Contra Costa Health Services is more aligned with the CDC's use of case metrics instead of hospitalization rates.
In the last few days, I've been very concerned seeing our hospitals fill up. So either way, we're now at a point where it's quite concerning.
Unfortunately, we have these higher rates and we need to keep those masks on during vaccination, even after vaccination. So I like that they did metric, but I would have done hospitalization.
Different takes and directions from the top all the way down the chain, contributing to the constant state of limbo for many.
I don't know if I can wear it in the grocery stores. Do I have to? Can I go in the grocery store without it? I don't know.
Yeah, it is confusing for sure, Kenny. Can you address some of the confusion with respect to CDC's threshold of what makes a county substantial, quote unquote, or at high risk of transmission? Where do they draw the line?
Yeah, Ken, so the number that the CDC gave out yesterday for its threshold, that number is a 7-day total per 100,000. But when you check your county websites, quite often you'll see a 7-day average per 100,000. So bottom line, all Bay Area counties fall under the substantial or the high risk level of transmission right now. That's why you're seeing the recommendation to wear those masks indoors now in all public spaces.
Got it. Makes sense now. Kenny Choi, thank you for